am so pleased to be joined by Dagmar Rosa-Bjorkeson, who is Vice President of the Multiple Sclerosis franchise at Novartis. And I am so pleased that we have had such support from Novartis over the years for HBA. We wouldn't be the organization that we are without their support. Dagmar, tell me a little bit about what you see as the burning issues facing leaders like yourselves in the near term for future.
Well, Eve, right now, as we all know, it is a changing time for us in the healthcare industry and in particular in pharmaceuticals. We really need to continue to work on what level of innovation we bring to the table. I think we need to do an even better job at demonstrating what kind of value we bring to healthcare. In particular, nowadays, as there's a lot of pressure on payers, on governments, as we demonstrate this value and the value of our innovations, whether it's products or it's our services, I think it'll be much easier for us to be able to partner with them, to be able to bring the innovations that we bring to the healthcare and to the patients. I think it's not entirely clear to them right now, and sometimes we put ourselves in a corner where we're really just pegged for a very small piece of the total value that we could be able to bring.
That's an excellent answer. It also places, an added pressure or responsibility on leaders. So up-and-coming leaders need to be aware of what these issues are. I wonder if you could tell us for a moment or two, what would you advise as the key development steps for leaders who are aspiring to make it to more senior roles, those that they need to be aware of, the steps that are going to take them to the top, such as awareness of those issues that you're describing?
Absolutely. Well, a lot is asked of leaders during times of change. There's no question about that. And I think that anything that we can do as leaders and those that are coming up in the organization to help broaden the thinking. I think when we think of what our roles are, we have to broaden that. We have to be able to learn. I encourage people all the time to take on stretch opportunities. I know you hear a lot about that, but you really need to be able to come out of your core area of expertise, cross-train, because when we are in a leadership role, you need to demonstrate value, understanding the full spectrum of what our industry delivers today, but is going to deliver in the future. So how do you do that? You have to be open outside of our borders, whether that is, I have a bias for getting international experience, for example, because some other countries have been experiencing changes in the healthcare environment that are somewhat similar to what we're experiencing right now. So really great learning opportunity to go into one of those countries and experience that. If you can't go directly into those countries, maybe you can be in a role where you're exposed to that. Another one, getting outside of our comfort zone, is going into different industries and learning how do they really bring value, how do they partner to be able to demonstrate that value, and we can then bring those learnings into our industry. And I think that the leaders that have that broad platform of thinking are going to be the leaders that are going to take us into this ability to bring value and be a true partner in healthcare in the future.
Okay. Dagmar, you've shared some incredible insights with us. I think we have to grab you for our advisory board. I think that it's a very important point that our leaders of the future cannot afford to be insular, as our companies cannot afford to be insular, because we're now delivering healthcare in a truly multi-stakeholder environment, and we're truly delivering it on a global basis. So thank you so much for taking the time to join us today.
Absolutely.
Thank you.
It's my pleasure.
Thank you. Thank you.